There are concerns over bilharzia outbreak at a school in Limpopo. More than 100 pupils have reportedly been affected and have since been treated. For more on this, I'm now joined by Neil Shikwambana, Limpopo Health Department's spokesperson. Neil, a very good afternoon to you. Thanks very much for your time. Have you been able to ascertain as to what caused or how this outbreak came about?
And good afternoon to the viewers at home. Certainly, we have received the reports. In fact, the school authorities or the education authorities, the area have received reports from the Water Service Authority who actually conducted the tests that then indicated that there is a stagnant river that passes through the village where the school is situated, where sometimes people go there to do laundry, to some to like small boys to do fishing and so on and so on. So water has been tested there, and it came out positive of the this parasite that causes bilharzia.
But the water you're talking about is not water that the community also uses, also consumes. In other words, it's not the water that they drink. They do have access to drinking water and for bathing and the like.
Yes, as far as we know, because if you look at this school that we're talking about, it has got a functional borehole which has got salty waters, and from the environmental health point of view, this parasite cannot survive in that kind of an environment. So it's not so much so about drinking water, because if you look at how this parasite get into your body, you do not necessarily need to ingest the infected water. It can get through your body, even through your skin. Just to come into contact with water in any way, you can get infected by this parasite that causes bilharzia.
So are you saying now those 150 or so pupils have actually been treated and they are not on any sort of danger zone?
Yes, the ones that tested positive have received treatment as of Wednesday and Thursday. But what we are doing now, because we've just received the results earlier this morning, we will need to increase our scope of testing and suspicion, because if you look at where that stream is, it actually divides several villages. There are villages that are on the left and on the right. So if you look at where Malwanda Primary School is situated, on the other side of the stream, there is also a village where there is a school. There are small kids who might have come into contact. So what we're doing is that we're heightening awareness in those areas to say to parents, if they see anything that looks like symptoms of bilharzia, they should quickly take their children to the nearest clinics. But we will take our mobiles there as early as of next week, just to make sure that we test as many kids as possible in the surrounding areas whom we suspect they might have come into contact with the water in that particular stream, because it's basically a stream that does not necessarily have a good flow currently, because there are no rains. So probably that is why the infection got to stay in the water and move, because those are some of the things. If it was a flowing river, it could have probably been washed or something to that effect. But like I've already said, we're increasing and heightening awareness, and we're increasing our scope of testing to get more children and learners to be tested as of next week.
Do you know what's the age range of these children, if I may ask? Because I mean, abdominal pains, diarrhea, and those things can be painful, especially for young people.
Well, these are the kids that we're talking about. The 142 that have tested positive are primary school learners, which might be something between 6 and 13, 14 years of age. So you're looking at that age range. But mostly, our analysis has also indicated that it's mostly the senior learners at the school. And this speaks probably to the patterns of behavior in the area, because if you look at kids that might be on their age 6, 7, they might not necessarily be able to go into streams and rivers. But if you look at a kid who stayed in turf, some of them might have already started fishing. Some might be looking after goats or cattle, that kind of a thing, which might have exposed them. Some might even go there to swim, by the way, because we cannot rule out that kind of possibility. And so we're also calling on parents in those areas to say they must make sure that they look after their kids, know where their kids are playing, and ensure that they avoid that kind of place so that they should not actually get infected.